Hi all, I'm Dr. Chris Morgan. This is Dr. Michael Duchinski. We're with Summit Urgent Care, and we wanted to talk to you a little bit about coronavirus and COVID-19, and specifically how Summit Urgent Care is managing that and how we want to help take care of you as our patient population. So in case you haven't heard, there's a national pandemic of coronavirus. It acts a lot like flu, but it's a lot worse than flu. It causes high fevers, it causes a lot of respiratory distress, and it causes really bad coughs. The problem with coronavirus, as compared to influenza, is that the number of people that need to be either hospitalized or put in the ICU on life support is a lot higher than influenza. So this is a dangerous virus, and it needs to be taken very seriously. That's why you're seeing the response to this. Because of this, at this time, so first off, I want to mention, at this time, Summit doesn't have the materials and cannot provide testing for coronavirus. That potentially can change in the future, but at this time, we do not have testing materials for coronavirus. With the public health risk that is associated with coronavirus, Summit is going to change how we manage and take care of patients, at least for the foreseeable future, until the pandemic sort of plays out a little bit more. And given the pandemic effects and that we're now actually starting to see infections in our region, we wanted to talk a little bit about what patients should expect if they are arriving to our clinic or if they want to be seen or taken care of for any of their healthcare needs. So starting March 19th, which today is the 18th, so starting tomorrow, Summit is going to start asking patients at the door if they have any symptoms that are concerning for COVID-19. And those include things like fever, cough, shortness of breath, respiratory symptoms. If they say yes to any of those questions, we're going to ask our patients to return to the car, and they'll be given information and a link so that they can register with either their phone or some of their smart devices, and they can register online to be seen as a patient. Once that online registration is complete, the patient will then be contacted, and Summit's going to arrange, we're going to have outside facilities where we can manage those patients. So we will contact the patient in the car. We'll say, we are ready to see you in our outside facility, which will likely be a covered tent, and we'll invite them into the tent, and then once they're inside the tent, then this is how things are going to go on. And I think you'll talk a little bit more about that.
Yeah, so once you, if you have respiratory symptoms or fever and you've been screened over to the tent to be seen, what you'll find in the tent is you're going to find a provider, so a physician or an NP or a PA who's going to evaluate you. They're going to be in protective gear, so they're going to have a gown on and a mask and some goggles, and that's gloves, and that's to help protect them and also to protect you. They're going to take a history to find out kind of what your risks are, if you're kind of high risk for complications from potential coronavirus, and then they may perform a strep or a flu test to try to rule out some other things. Once we get all those results, and actually once we get the test, we may ask you to go back to your car, or even in fact may ask you to just go ahead and head on home, and we'll contact you with those results and kind of what to do from there. Really, in the end, what it is that if you're healthy and you're doing well and you don't need to go to the hospital, the best thing we can do is to have you stay home and monitor your symptoms and really just try not to get anyone else infected. If you have the flu, you should stay home and try not to get anyone infected. If you don't and it ends up being coronavirus, you should still try to stay home and not get anyone else infected.
And then to add on to that, even as dangerous as coronavirus is, the vast majority of people who do get infected with coronavirus do well, and it acts like a bad respiratory infection, despite the fact that a significantly higher percentage of people are getting sicker as compared to flu. Most people will do fine at home with good home care. So it's making sure you're staying hydrated, making sure that you're resting as appropriate, making sure that you're quarantining as appropriate, and not going out and being around a lot of other people. Now, let's split that apart and let's distinguish that. For people who have absolutely no symptoms or concerns for coronavirus, we still want to be able to take care of you too. So when the greeter at the door asks you those questions and you say, I have none of those things, I'm not concerned about coronavirus, then potentially we will ask you to come into the clinic, and then the standard protocol will be followed where we'll register you at our front desk. You'll be triaged the same way we normally triage you now, and you'll be seen by a provider. And if you need an x-ray or if you need testing back there, that will be taken care of the way that we've always taken care of our patients. But we wanted to try to minimize as much risk as we can by trying to pull all of our respiratory complaints to the outside facilities where we can be a little bit more strategic about how we're managing things. So again, I'm Dr. Chris Morgan. This is Dr. Michael Duchinsky. If you have any questions, please reach out to us and we're going to help take care of you.